Okay.
Done reading?
Yes.
Okay. So if you've read and understood, considering its surgical anatomy station, please tell me. Right. What are you looking at? These are the,
Yeah,
yes, triangles of the
anterior
neck.
and posterior triangle of the neck.
Very good. First, you're dividing the neck into anterior and posterior triangles by which
Yes.
by which structure?
Sternomastoid muscle.
Right. Which is, if you could identify in this
4.
image. Very good.
4.
Number 4. Okay. Please tell me the attachment of sternocleidomastoid muscle.
Sternocleidomastoid, it's attached to the mastoid process
Yes.
to the sternum notch anterior.
Very good. Okay. Now, coming to the anterior triangles. This
Yes.
anterior triangle is again divided into how many triangles?
2 or 3 triangle.
Yes. Okay.
Submandibular gland triangle and
This is
internal
13.
carotid.
If you can identify
That's
as well.
13. Yeah,
13.
13.
Right.
And also the
Which triangle is this?
submental.
Very good. And then
And
this is 11.
then
Okay. If you could identify number 2, this is also one triangle.
carotid triangle, internal carotid
Right.
sheath.
Yes.
Yes.
And which muscle is this, number
This
1?
is posterior belly of digastric.
Very good. And if you can identify number 8, which
This is a
triangle is this?
platysma.
No,
Platysma,
no.
this is
9 is what you're telling me. What is 8? Which triangle is this? Look closely, please.
infrahyoid. I don't know actually. It's submandibular.
Okay, there should be
I
one
don't.
carotid triangle. Okay, muscular triangle.
Muscular triangle, yes.
All right. Okay, which muscle is this, you said? And which is
This
this
is
one?
omohyoid. This is 12 is superior belly of digastric.
Okay, very
And
good.
9 is omohyoid.
Please tell me what are the contents of submandibular
Submand
triangular?
it contain submandibular gland and lymph node,
Yes.
submandibular lymph node, and containing lingual hypoglossal nerve,
Okay,
yeah, and lingual nerve.
right. Okay, right. If you could tell me what are the contents of the carotid triangle?
Carotid triangle contain internal carotid artery
Yes, and
and and uh, pre and lymph node also.
okay, we'll come back to this one later.
I will come back to.
There is
Yeah.
something more important on the surface, which is not included in the carotid triangle, but it's over. Okay, please tell me the boundaries of the posterior triangle.
Posterior triangle, anterior line is from posterior border of
Yeah.
clinomastoid muscle, and the posterior line is by the anterior border of trapezius, and the base of the triangle is by the clavicle.
Yes, very good. And what is this? Because posterior triangle is again divided into 2. What is number 3 and what is number 7?
Uh,
Yes, okay, we'll come back to that later.
7 is the root of the neck.
Yes, now you remember. Okay. Please, if you could identify, what are you looking at?
Lower parts of the neck.
Yes, from the front view. I'm sorry, I accidentally changed the picture. And which organ is this that you're looking
This is
at?
thyroid gland.
Thyroid gland. Please tell me the parts of the thyroid gland.
Thyroid gland have 2 lobe, right and left, and the isthmus in the middle.
2 lobes, and which is
Isthmus.
isthmus is E.
E.
Yes.
Yeah.
Okay, please tell me what is the blood supply of the thyroid gland?
blood supply is supplied by superior thyroid artery and inferior thyroid artery and thyroid EMA artery. 10% of people have a thyroid EMA artery.
Yes. Oh, and venous drainage?
And venous drainage by superior thyroid vein and middle thyroid vein and inferior thyroid vein.
Right. Please tell me what is the nerve supply of the thyroid?
Nerve supply of the thyroid.
Yes.
It's supplied by sympathetic fiber.
Yes. Plexus.
Yes.
All right. Okay. Please tell me embryologically, thyroid, its formation is of thyroglossal cyst.
The embryology of the
Yes.
thyroid.
Yes.
The thyroid is formed from the foramen cecum in the base
Yes.
of the tongue. Then it descends in the root of the neck. Then it descends on the hyoid bone and loop around the hyoid bone until it reach the lower part of the neck.
Yes.
Any stoppage of this descent, it lead to ectopic thyroid gland.
Yes.
Yes.
What is the
Not
yes?
the other. If this descending by duct, if this duct not closed,
Does
it
not
lead to
yes.
the
Yes.
thyroid cyst. Thyroid.
Right. At what level this thyroglossal cyst is located?
Around the hyoid bone.
Okay, thyroid. All right. Okay. Incomplete. All right. Please tell me. Right. If you could tell me when you're okay, when you are. I actually wanted to tell me. Why thyroid moves when you're doing or deglutition when you're
Because
doing
the
deglutition?
Yeah, because the thyroid is attached to the pretracheal fascia,
Yes.
and the pretracheal fascia is attached to the hyoid bone, and the hyoid bone is attached to a muscle of deglutition and larynx, and so it's up and down with the deglutition.
What are the posterior relation of the thyroid gland?
Thyroid gland is parathyroid gland.
How many are they in number?
Four parathyroid gland.
Four in number. Okay. Two superior
Two
and two
superior, two inferior.
inferior.
Yes.
Right. Okay. Please tell me what are you looking at? If you could identify number 22 and 11.
Okay, 22 is common carotid artery.
Yes.
And 11 ولا what is
Yes. 11. Yes.
11 is a jugular vein.
Please tell me the formation of the number structure 11. And these are the two arteries.
Retromandibular vein and posterior auricular vein or occipital vein.
Yes, and then if you could tell me
Yes.
on surface anatomy where exactly they are formed and how they are formed and how it
Uh, it,
descends.
it's formed by the retromandibular vein behind the mandible and descend to internal jugular vein.
Okay,
Okay.
good.
Can I return to this question?
Which question?
This one for the number 11.
Yes.
We will return to it back
Okay.
because I
Okay.
couldn't.
All right. All right. Okay. Please tell me which nerve is located very close to inferior thyroid artery?
Inferior thyroid artery is recurrent laryngeal nerve.
Yes, please. And which nerves are most commonly injured while you're doing thyroidectomy?
Recurrent laryngeal nerve and superior laryngeal nerve.
And vagus as well.
Yes.
Okay, how would a patient present when there is damage to vagus nerve?
To the vagus nerve.
Yes, please.
It is a branch of recurrent laryngeal nerve, mean hoarseness of the voice, or could be respiratory compromise according to the
Right.
injury severity. Yeah.
Yes. Right. Yeah, I think you've covered everything. Yeah, I think you've covered everything I could ask. Yeah, thank you.
Mom, can you return to the vein that you asked me about it?